The Hogg Fellowship is more than anything else a learning opportunity, a chance to explore a really interesting area of policy, dig deep into it, learn about legislative advocacy, and improve your professional skills in that area.
I was pushed to be a leader, which isn't my natural role. I like to do more research and behind the scenes kind of work, and so to be put out there and seen as an expert on certain issues was a little intimidating at first, but it really gave me an opportunity to grow. And I think that's one of the biggest takeaways that I'll have from the fellowship. And to be honest, it's kind of cool when you realize, like, hey, now I'm seen as, the go-to expert for some of these things.
It was really impactful for me because I was able to do a lot of learning and growing while also actively advancing my career and doing work that was important to me and important to the communities that I live in.
Working the legislative session is exhilarating and rewarding and oftentimes incredibly defeating and challenging, but it's an experience that I will use for the rest of my career.
People living with a mental health disorder are much more likely to use and abuse drugs and to become addicted to opioid prescription pain relievers.
What I'm most proud of is that we were part of passing SB 1462, which is a bill that allows access to naloxone, the opioid overdose reversal drug. And because of the work of that group and our partners on the ground at the Capitol, Texas now has an open prescription for naloxone. And I know that hundreds of lives have already been saved.
It's important to note that recovery isn't a cure, but rather it's a journey in which individuals with mental health or substance use conditions are able to manage their illness and in a way that allows them to lead a meaningful life.
We have developed a cohort of both past fellows and current fellows and mentors all working on these issues, and it's really just expanded the amount of knowledge that has existed on mental health policy in Texas, and also just expanded the capacity of the advocates. So it's been so beneficial for helping during session and helping during the interim to really help push some of these changes forward.
The mentor learns just as much from the mentee as vice versa. So it's really an opportunity for everyone to grow, the mentor as well as the person who's the fellow.
It was really great working with Miriam and being able to learn from her experiences in the field, being in the field for so much longer than I have, and hear her perspective on issues that maybe are different from mine, and being able to learn and grow with her.
The relationship has grown and blossomed, and Colleen has done a marvelous job of up-leveling her skills, particularly in public speaking, in research, and in being able to stand up and say, in a fairly passionate way, this is what I believe in and this is what is right. This cohort is very savvy, very smart, and very dedicated. And they come from a variety of fields. Many of them are social workers, some of them are recent law graduates. And what I see is a passion.
One big takeaway that I will have, and that the Academy definitely reinforced for me, is that community is powerful, and that when you have a lot of people who care and are connected and passionate, a lot of amazing work can be done.
I see myself advocating on behalf of my peers growing up, on behalf of my grandma, on behalf of the kids who don't have a voice.
I love working in policy. I really feel like I've found my niche, what I'd like to be doing, long term, and what I'd like to be doing in my career is working on policies that can make things better, that make our health and human services better for Texans.
The impact of the Hogg Foundation's fellowship program goes far beyond the fellowships themselves. They've created a group of passionate, dedicated leaders in mental health policy who will continue to make Texas a better place.